to all our audiences in my show today. And I really have a very special guest today. He is a cancer surgeon coming all the way from Ahmedabad, Gujarat. Yes, none other than I'm talking about Dr. Shakti Singh. Welcome to the show. And I know you are a cancer specialist, but it is specifically for head and neck as well as oral cancer. Correct, sir?
Yeah, thank you, ma'am. Thank you, Dr. Bhoommika, for inviting on this show.
You're welcome, sir. So we all know and we hear about the word cancer, but here, the very tricky thing is head and neck. How does that goes? Like, if you can just brief us more to our audiences about it,
Okay.
and of course, oral.
Yeah, so now the trend has come wherein we are doing cancer surgery on a specific organs.
Okay.
So earlier it was one cancer surgeon, check for all trade like that. So now we do organ specific cancer surgeries. So
Okay.
for oral and neck cancers, or we say head neck cancer, means other than brain, everything above the clavicle, these are the clavicle bones. So everything above clavicle, other than brain, everything comes under head neck cancer. It can be scalp cancer, it can be ear, nose, throat, oral, palate, everything comes under head neck cancer.
Okay.
Then we have breast cancers, we have thoracic cancers, abdomen cancers, GI cancers, uro cancers. So there are a lot of specific organ specific cancers are there in the body. We work on head and neck cancer. So above clavicle, as I said, everything other than brain. So that is the one differentiation, and this is organ specific.
Thank you so much for defining that, because I know, because that definition is very important, and
Yeah.
I don't think so many of us knows it.
Yeah,
right?
so everyone they consider as a cancer surgeon. I get a lot of patients with a breast cancer. They come for opinion. Then I say, "Ki, I can give an opinion, but I am not the right person." One of my team member, we have a team of 7 doctors. We do the organ specific work. So in my team, like Dr. Nitin is a robotic surgeon. He does all the GI cancers and uro cancers. So I usually refer to the concerned person. I have knowledge. I can guide them, but we as a team of head neck cancer, we operate only above clavicle. All the cancers above clavicle.
Wow.
So that defines the our
Absolutely, it
specialty.
defines your specialty
Yeah.
region. Basically,
Yeah.
it's above the clavicle, which
Yeah.
is the neck bone,
Neck
kind of
bone,
a
shoulder. Yeah.
shoulder bone,
Yeah.
you
Yeah.
can say, and but not the brain,
Not the brain,
but till the top.
everything.
Just exclude the brain. Correct?
Yes.
I
Yes.
think I
You
have
are very
understood
right.
it.
Yes.
I've understood it in the righteous manner.
Right.
So, sir, just tell me, like, what is the stage, or see, I know cancer is something we don't know who is having it, when they are having it, when do they get it, we don't know that. But what do you think the right time for a person to actually go in for the screening? Because that's the main important thing, right? A person needs to go and get it detected. How the person will get it detected or diagnosed? Only when the screening happens.
Right.
So how a layman person knows it, that this is the right time for screening for cancer?
Okay. So when we talk about screening, still in our country, especially if I talk about Rajasthan or Western Rajasthan, people are not prone for screening. They usually do not visit a doctor until unless they get a pain. So the direct relation is, if a patient has a pain, then only he will go to a
Absolutely.
doctor.
Absolutely.
So what is happening is, these cancers in early stage, in stage 1 or stage 2, is totally non-painful.
Okay.
So if a patient develops some ulcer on the tongue, for an example, he will take some medication from the medical store for burning sensation. He
Over
will
the
put
counter
some
medicine,
gel.
which is so common in
He will, yes, he will put some gel. He will take some painkiller.
right.
The mild burning sensation is gone, and he thinks that I'm recovered from that ulcer. But unfortunately, that ulcer is still persisting.
Okay.
If an ulcer persists more than 15 days,
Okay. So
then
that's the benchmark,
that's a
which needs to
benchmark.
be noted. More
Which
than 15 days.
more than 15 days. See, everyone can develop, and anyone can develop ulcers. That is because of your some disturbance in the GI flora, or you have some GI infections because of stress. Many people at the time of exams they develop the oral ulcers.
Yes.
That is called as the aphthous ulcers. But those are not cancer ulcers. All aphthous ulcer, by nature, they will heal within 1 week or maybe 10 days. But any ulcer which is more than 15 days, that need to be examined by a nearby doctor or a cancer specialist. So screening is not very much in the practice.
Right.
Where we are making public aware is, if you have a habit, so we call this cancer as a preventable cancer. It's a habit related cancer.
Right.
So if you have a habit of, be it smoking or gutka, pan masala or supari, I should advise all the audience that if in your family of you have a habit, please get your oral screening done. Going to just a dentist and just ask him, just get a
Right.
screening done. If there is any suspicious lesion, dentist will connect to the
Right.
surgeon, or he will refer you to
To the right
the right person. So
person.
that screening need to start right from beginning.
Right.
That has to come from the public awareness.
Correct.
They need to visit to a doctor.
So you talked about oral cancer. So let's talk specifically about that.
Yeah.
What are the symptoms? Why it happens? When to go to the doctor? If you can just give an entire brief to audiences, it will be the best thing, I think. So
Right.
please
So
tell us from this.
yes, ma'am. So when we talk about why this oral cancer happens, as I said, it is a habit-related cancer. So this cancer is related to tobacco chewing, be in the form of keni or the mirage, these gutkas, or now what the government has done, they are selling the pan masala and tobacco separately, so people mix and take it, or the smoking of bidi, cigarette, the e-cigarette, everything contributes to the habit.
Okay.
These habits are direct relation with the development of oral cancer.
Right.
Now there are many people who are having the habit. They counter me always कि साहब बाकी जो खाते नहीं है उनको भी तो कैंसर होता है. But I tell them one thing. You sit in my office.
Right.
95% of patients whom I see have a habit of tobacco.
Yes.
So what is happening is, I agree that not everyone develops cancer.
But 95%?
95%.
It's a big ratio.
It is a big ratio. So what is happening is, suppose 100 people are eating tobacco. Everyone will not develop at the same time. I always say the duration can be different.
Right.
We say 60% को तो पक्का होगा ही होगा. But everyone thinks कि हम तो 40 में आते हैं कि जिनको नहीं होता है.
That's the perception they
That's
have.
the perception.
That's the perception they carry.
They carry.
Because of lack of awareness.
Because of lack of awareness. Second is, people have a lot of misconception about alcohol. People say कि अरे alcohol से तो कहाँ cancer होता है. But now our research studies, we have the evidence that alcohol standalone is a responsible factor not only for oral cancer, but it's for the food pipe cancers, that we call it esophageal cancers,
Esophageal cancer,
gastric cancers, or stomach cancers. In a layman language, I can say stomach cancers. Then there are a lot of liver cancers are associated with the alcohol. So alcohol is definitely not good for health. Government also writes it's consumption of alcohol is injurious to health, but alcohol also should be considered as bad as all these habit related cancers. Now, what are these 5% of cancers which patient doesn't have any habit, still they have got the cancer?
Right.
Okay, so that happens with I'll tell you, a sharp tooth. If a patient has a broken tooth, the tongue or the buccal mucosa, we said the cheek, inside the skin of the cheek, is directly irritating. That irritation, continuous irritation,
can cause
leads to oral cancer.
It can develop an oral
oral
cancer with time.
Yes,
it develops. That's evident.
Evident.
Oh my God. That's a news. That's a news.
Yes.
Seriously.
So all the sharp tooth. So why we say ki visit dentist every 6 months or a year? Because a dentist is trained that he will tell you that this is a sharp tooth. Either get it treatment done, or you take it out this tooth, rather than it harms you and land you in a disease like cancer.
Imagine the connection between a dental issue which grows into a cancer with time, if you're
Right.
not taking care of your oral hygiene. Correct me if I'm
Correct.
wrong.
Correct.
That's how it is. That's how we can link it together.
Yes, you are very true. So we have taken first thing on sharp tooth. Okay.
Right.
The next thing I'll stress on is oral hygiene.
My God. So
Oral hygiene has a direct relation with development of cancer. And these are not which we are saying out of experience. This is what is written in the textbooks. But everyone will talk about, ki tobacco causes cancer. But yes, it causes. But these also should not be looked down.
because no one is talking
Sharp
about that.
tooth,
No one is
yes.
talking
Oral
about
hygiene, having a poor oral hygiene is direct relation with cancer.
that.
So why visiting a dentist is important is he is the person who will manage your sharp teeth. He is a person who will do your habit breaking
Right.
counseling. He is the person who is going to advise you about how you should maintain a good oral hygiene.
Which is
So
very
these
very
are the
which is very very basic,
which
right?
are very
Which
basics,
is very basic, right?
very basic. So these are the reasons wherein which are direct relation with the development of cancer. So if I say cancer, it is a preventable cancer. Oral cancer is a preventable cancer.
Preventable
That is the
cancer.
one term we use. Second is when we talk about symptoms,
Hmm.
that how the patient knows that he has got some symptoms. Cancer doesn't happen overnight. We wherever we always talk that God is partial, not partial, but God is grateful to us that cancer doesn't happen overnight. कि morning में सुबह उठे और आपको मुंह में cancer है. It doesn't
True,
happen any
true.
day.
It takes time.
From normal mucosa to dysplasia to carcinoma in situ or precancerous carcinoma in situ and then cancer. There's a lot of gap.
So that's the stages of cancer that you
That is
just now.
not stages. That the pathway before developing a cancer.
Okay, so that's also defined.
That's also
That's also
defined.
very well defined.
So we
Okay.
advise patients that from normal to development of cancer, there's a gap.
There's a gap.
If you get to the right people, if you get to the right doctors,
At the right time.
you can be saved from getting into these dreadful disease of cancer.
Absolutely, absolutely.
So if we talk about symptoms now, so any white patch in the oral cavity, red patch or red and white patch, ulcer, if a mobility of teeth, many a times what is happening is they develop gingival cancer. Gingiva is, we call it as gums.
Gums.
So if they have all the teeth are good condition, but one tooth is mobile, that is also can be cancer, developing the cancer below the tooth.
Okay, in
So
the
what
gums.
happens is
Inside the gums.
inside the gums. So usually what happens is if dentist by his lack of awareness also he just pluck out the tooth, the wound is not going to get healed. And when the patient comes back to the dentist, he will see there's a growth or he will see there's some abnormality. Then he's referring to a surgical oncologist or a cancer surgeon. He's diagnosed with cancer. So what patient thinks, मेरा दांत निकाला है इसलिए मुझे कैंसर हो गया.
Yeah, that's what a layman person will think.
That is what a layman person thinks. So I think it is very important that दांत निकालने से कैंसर नहीं होता है.
Correct.
There was some existing cancer which has been overlooked by the
Which was growing somewhere beneath the teeth.
Correct. Which was not
identified or detected before.
Yes. So that is where we as a foundation, Asian Head Neck Cancer Foundation, we have a training course by Education for Cancer for Dentists.
So every dentist can avail this?
Yes, every dentist can avail. And this course we started in 2019. It was online, then we did a hybrid course, and now the course is going to all the Asian countries. We conduct course in the Nepal, in Bangladesh, in Malaysia. We are going to Sri Lanka in the next week or next 10 days. We have a plan in Sri Lanka. So because the incidence of oral cancer is very similar in all these countries.
Okay.
So we need to train dentists that ये जो लोगों का myth है कि दांत निकालने से कैंसर हो गया, that need to be addressed.
That's so nice of you to actually take such an initiative like this, where you are training the dentist.
Yes.
You're training the dentist so that if any patient comes, he knows where to refer, whom to refer, right?
Correct.
So that's how it is, right?
Yes, he need to identify.
He need to
See,
identify
main
which
is,
is the patient.
yes, he need to identify. We teach them how to identify the early lesions, so that
Okay.
these patients can be stratified into high risk, intermediate risk, and low risk. If a patient is a high risk, ask the patient to come for the regular follow-up, so that the moment he developed a small evidence of any cancer, that can be treated with lasers. Patient doesn't have to go some big surgeries.
Okay. So we have the laser technology in place
Yes, so
where
for
we can
early
treat it.
lesions, for precancerous lesions, laser technology is available. It's very readily available. It's very healing time is good. Your surgical time is good. Financially also, it is not that burden to the patients. So everything that can be managed in dental clinics.
Absolutely
Patient doesn't need a hospitalization for doing lasers for intraoral things. So it's very easy. But a dentist also should know, and
correct.
patient also should
And
know.
the
So
patient should
we
also.
work on both the aspects. See, I don't want to work on a patient and dentists are not trained enough to look at the lesions.
True.
So
Very
that
true.
is the reason that we want to balance both the things and train dentists as well as the general public.
Which is so good of an initiative, sir.
Yeah,
And just tell more us about this. That once it's detected, what is the further process? Like how a patient can approach you or your team there in Ahmedabad, because at
yeah,
times like all kind of facilities are
yeah.
practically not available locally in any small town or a tier 3 town. So what is the process? If you can just
So
talk a little bit about
now
that.
we once a biopsy has been done, the investigations are done, patient is diagnosed with the cancer. The patient have got three choices for the treatment. So we call it as a primary treatment and a complementary treatment.
Okay.
Okay. So primary treatment consists of surgery, chemotherapy, and radiotherapy.
Okay.
When we talk about oral cancers, 80% of these patients they undergo surgery. That's the first and the best treatment.
Okay.
For stage 1, stage 2, surgery only suffice. There's no need of chemotherapy or radiotherapy.
So with the surgery, the cancer is removed.
Removed, and it is the best way, because that gives very good quality of life.
Right.
So patients, they are afraid of surgery, but I really put in a lot of effort to convince them that stage 1 and stage 2 surgery, if surgery for stage 1, stage 2 is done, you are not going to undergo the trauma which probably the radiation or chemotherapy causes. See,
Absolutely.
surgery healing time is very less.
Yes.
Your side effects are very less.
Yes.
But unfortunately, the side effects of radiation,
Is
it's very long term,
very long term.
and it's very painful. Even
Very
though
painful. Yeah.
पेशेंट्स को लगता है कि मुझे बिना ऑपरेशन का इलाज कराना है.
But then that path is not not that easy.
Yes, so that's
Yeah.
what I want to
It's
tell
full
to
of
my
sufferings.
audience, that
It's full
the
of
surgery
sufferings.
surgery is the best. Stage 1, stage 2, stage 3, stage 4 surgery followed by radiation therapy.
Okay.
So that is the treatment we have,
Okay.
primary treatment. Now with the government schemes, the Jodhpur probably have evolved in the cancer care also. We in Jodhpur also we have got 3 4 cancer centers. They are doing good job. The most of the treatment is being covered in by the government schemes. This uh, Ayushman Bharat scheme is there. So
Okay.
a patient gets complete free treatment.
That's so nice.
Radiation, chemotherapy, surgery, everything is free. So I usually talk earlier. Patient used to think about कि मेरे को when I go undergo surgery or treatment, I will have to have lot of financial loss.
Right.
It's not loss, but but they used to think कि my family is going through the lot of financial burden.
Right.
But now the government
It's
has
all
taken the toll,
covered in
right?
this insurance
Everything.
plan.
So financial hurdle is gone. It is only the hurdle is here,
True.
that they need to get the treatment as early as possible.
The decision making.
Decision making. That is where probably our people, if I especially talk about Jodhpur, because I visit Jodhpur every month.
Okay.
Whosoever are my patients, who has been operated at in Ahmedabad, I come to see all these patients,
Okay.
because surgery is about a responsibility. It's
Absolutely.
not once you have done, especially in the cancer, you need to have very close follow-ups.
So basically, these are the post-surgery follow-ups.
Yeah, these are post-surgery follow-ups. So in cancer surgery, you need to look for the patient, examine every 2-3 months, because there are two reasons. One is, there are patients who thinks that now my cancer is done, they will start with the habit. Unfortunate.
Right.
We all, if they visit me, they'll be always under the fear ki sir ko pata chal jayega, and he will be, and I counsel them every month, you don't start with a habit. So we are putting them under fear of not starting the habit. Those who doesn't come for follow up, I get an idea that they've started with a habit.
Yeah, that's quite obvious.
That's quite obvious.
But what are the chances of redeveloping of the same cancer again in the same patient?
So
What are the chances if they again go back to their same
correct,
habit?
correct. So when we talk about the developing another cancer, what is happening is, we call it as a field cancerization.
Okay.
So what is field cancerization? When a patient consumes chewable form of tobacco,
Okay.
whole oral cavity is traumatized.
Right.
Cancer developed at one portion. We have done the treatment, we have removed the cancer, everything has been done. But he has a tendency to develop a cancer on the other side, in the tongue, palate, anywhere, if he continue with the habit.
Okay.
So if a patient continues with the habit, he has got a very high chance of developing a second cancer.
What is the ratio? What do you think as per the patients that you get?
So when we the ratio, usually we divide into the staging. So cancer is divided into 4 stages:
Right.
stage 1, stage 2, stage 3, stage 4.
Right.
Stage 1, if we say, the chances of survival or developing a second cancer is 10 to 15%
For stage 1
for
patient
stage 1 and stage 2.
who came to you, got the surgery done, he was into stage 1, everything okay, gone back home, but
Yes,
the 10 to 15%
chances that he
chances are
might
there
develop
and
another
he
cancer.
might develop.
Another cancer. But as the staging increases, their coming second cancer also increases.
That's
In
scary,
stage
doctor.
4,
That's
it is
scary.
almost 50% of the patients develop a second cancer.
In stage 4.
Stage 4. And survival is less than, in our country, is very less. It is
Yeah,
probably 10 or 15%.
that's too less, doctor. That's
And
too
that is
less.
the reason that we need to work on early detection.
Absolutely.
Whatever technology, still we are not able to. I'm very it's sad for me also to say this, but with whatever technology, we are not able to give the survival benefit to the patients of stage 4 disease.
That's sad, doctor.
That's a sad reality.
So
I
it
say,
is very important
yeah,
to detect the cancer at stage 1 and stage 2,
that is the key.
because that's what should be the focus, right?
That's what should be the focus.
I think everyone should focus on that, and let's eliminate the stage 3 and stage 4, because if someone is there in stage 4, as you rightly said, that chances are negligible.
Yeah.
There's no way the patient will survive. So in that point, awareness is the key, doctor,
Yes, correct.
which you are doing via our podcast, and
Yeah.
I really hope that we do more such awareness
Yeah.
podcasts with you.
Yeah.
And so you were talking about the percentage of for developing the cancer again. So we understood all this, but now again my question goes back to the layman thing, that for example there are people who are having tobacco, which is as a habit, and say they developed it, how they can approach to the surgeon? It is always through a dentist, or there is a direct approach wherein they can go directly? How is it? Because normally it's always, if I see if there isn't something oral problem I get, I will definitely go to a dentist.
Right.
That is a basic step, like how we go to stairs. Like if
Yeah.
I take stairs, I will take the first step.
Yeah.
Anything happens in the mouth, we go to a dentist.
Dentist.
So now you guys are already training the dentist.
Yeah.
Right? So if that dentist is trained, definitely he can route that person to the right surgeon.
Correct.
Maybe that person is sitting locally, or wherever, like you are from Ahmedabad, so that person will be referred to Ahmedabad. So let's talk about the stage where the person is referred to Ahmedabad. What is the total time frame that it takes, for example, for, let's talk about stage 1, stage 2 patient, for
Okay.
recovery,
So
from the operation to recovery?
Correct. So before I talk about operation, you were talking about the role of dental surgeon. So I'll just elaborate
Yeah,
something more on
please,
the
please,
dentist.
please do that. Please do that.
Why I tell you why. Now our country has got highest number of dental colleges across the globe.
Yes, I know that. I agree with you.
So there are 324 dental colleges across the globe. We have got the highest number of dental schools. We have got highest number of dental practitioners in our country.
Right.
Third, the dental
Right.
professionals are sitting in every town, every not village, but at every tehsil or the nearby place. Everywhere they are there. Training dentists become very easy for people to approach them.
True.
It is just training dentist. If one job is done, naturally the other will complement it.
Absolutely, doctor. So here we need to target all the dentists first.
Yes, so that is the reason that our this course by name Education for Cancer for Dental Professionals, we had already trained more than 1,000 dentists in our country and other countries also. This course is running down, and we are also we are trying to increase the number of dentists coming for this
Because it's
training.
very important, doctor. It's very
Yes,
important.
yes,
Because your first customer is dentist,
yes. So
right?
and people also feel comfortable to visit to a dentist. See, people will not come to me as a cancer surgeon. He will always have fear कि साल के
Absolutely.
बाद जाऊंगा कहीं बोल दिया cancer है तो.
Absolutely. Nobody wants to go to a surgeon.
Yeah,
Matlab,
everyone have
you know,
fear.
the layman thing is that why I have to go to a surgeon? I mean,
Cancer surgeon.
do I have to go through a surgery? Oh no. They have that
Right.
kind of a perception.
Right.
So I think here a biggest responsibility and the role is for a dentist in the town, in the
Yes,
city. If
yes.
that particular dentist is aware, then I think it will create a very big awareness.
Right.
Because that it becomes the responsibility. It's the second step. First
Right.
step is you guys are giving that training to the dentist. Now, if that every dentist, you said there are a large number of dentists, so there's a lot of work needs to be done, sir.
Yeah, yeah.
Yeah, we
So
need to
we
approach
are
all
working.
the
See,
we need to approach all the dentists out there and first tell them that please understand this importance, very important, because every dentist is like representing you guys then.
Correct. So we in my conference recently, what we concluded, we have given a very small figure how dentists can play an important role in the screening, mass screening.
Yes.
So if there are 4 lakh dentists practicing, one patient, just screen one patient in a day.
Mm.
So in a day 4 lakh, in a month that comes around 12 lakh.
My God.
In
Is
a
the data
year, in a
is
year.
that data really like practical? Are we getting that
No, no,
much of
we
are we getting that much of people screened?
no. I'm
But we
just
can.
we
You are saying
can
you
see
you
we
can
we
that
are we
we
are
can
just trying
prepare
to
ourselves as a nation. We can prepare
we can
ourselves.
prepare
We
the
are ready.
dentist
We are ready
that
in that way.
we can do crores of screening just in a year. And now I tell you how we interconnected this program. We already work in Western Rajasthan. See, I always I belong to Rajasthan. Rajasthan is my heart, my birthplace, everything. My people. Yes, I am practicing in Gujarat. I like the city, the good people, but still my heart, always have a soft corner for the Rajasthani
I
because वो
can
तो रहेगा ही
understand that.
रहेगा.
वो तो
So
रहेगा.
that cannot
वो
be
तो
changed
रहेगा. We
whether I
can't
go to
because you belong to this place.
yeah, any other country. So we started this project of early detection clinics. So now we train the dentist, then we take the dentist associated with them. So now we have 32 clinics in Rajasthan. Okay.
Okay.
Every clinic have to do 30 screenings
Okay.
in a month. That data we have. We started 3 months back. That data we are going to compile in a 6 months or a year time, and we are going to give a big data. So imagine 30 clinics, 30 screenings. So in a month we get 1,000 screenings done.
Right.
With only 30 clinics. In a year it's 12,000. If it is 100 clinics, we imagine 12 lakh, we can do it. So that the data, once we started this pilot project, and I'm very sure that we are going to approach the government. We are going to.
That's what I was coming back. That
Yes,
what is the government's role in this? Because government has to play a very, very important role in this.
Correct.
Until unless the government intervenes in any such projects, only then it can be a mass hit. Because
Correct.
we want to reach to that layman person there. And I think
So government is, as I said, government is giving free treatment. Treatment aspect, government has made it free. But see, still government have some limitations. See, we cannot rely on government for everything. We also, as a society, we also need to take some initiative.
right,
We also need to contribute to the nation.
absolutely.
And as a society, as a foundation, as an NGO, I think we also need to work on the prevention and early detection.
Is there any broadcast that happens from the government's end for dental, for
No,
dentists?
no.
Don't you
There's no
think so?
program. We we
Don't
we,
you think so?
we
There
are
should be some collaboration which
yes.
should be done directly. I'm not talking about the end user, which is a cancer patient, but the very very key role of a dentist.
So
Don't you think
our
so? It
our
should be
idea
mandatory.
behind doing this, see, government always wants to have some data. So why we are doing this?
Like
As I said,
we
pilot
collect that.
project.
We collect the data.
Yes. So this is a pilot project. We do this pilot project, and then we give it to
Then
the
we
government.
give it to the
If
government.
we can do with 30 clinics, if you support us,
We
we
can
can make
do
it 100 clinics or 200 clinics, and we can give you the data. See, our and motto is screen everybody.
yes, screen everybody.
Screen everybody.
Screen everybody. That should be a right to screening.
Right to screening. We see we have a video. I'll definitely share with your platform also. We have a video on self screening of oral cancer. See, oral cancer. First, I said visible, preventable cancer.
Yeah,
Second, I say it's a visible cancer.
which you
If
can see with your naked eyes, basically.
which
Which once you see and you try to see yourself in the mirror and you find something.
yes, we have a
That's what.
beautiful video. I'll
Yeah,
share with you
oh, that's nice.
that you can do the self screening also. It is, see, the problem is about lack of awareness,
Correct.
lack of awareness, and
Correct.
lack of awareness, or rather, I say the carelessness of the general public,
Absolutely.
masses. If we can hit to them, if we can make them aware, I think that is going to have a 360-degree change in early detection of oral cancers. So it's a visible cancer. You can stand in front of mirror, you can look around. Do you have any swelling, any abnormality,
Any pain?
any pain? See, if oral cavity is such a sensitive that if you get a small thread, if you get a small hair in your while eating, you will just throw it out.
Of course, you will
It's
feel
so
it.
sensitive.
You will feel it. Your body tells you.
There's something different there.
Imagine how intelligent the body is.
Of course. So how a patient cannot feel there is some abnormality, or there's a growth, or there's some abnormality? It is not possible, right?
Absolutely, I agree.
So it is all about opening this.
True.
So what we are doing is we circulate this video on self screening also,
Okay.
and we are training dentists to nearby. See, you don't have to travel to Ahmedabad, you don't have to travel to any place. See, if a patient is sitting in Siroi, he just have to go to a nearby dentist and get a screening done.
Right.
And if there's an abnormality, he
Right.
just have to connect to us over the digital transformation or digital era is there.
Absolutely.
The dentist can connect to us digitally.
Yes.
He doesn't have to send every patient to Ahmedabad for the screening. See, there should be a proper
Channel.
referring channel.
Yes, referring channel. That's
See,
what.
a patient with a doubt of having an oral cancer, we don't want the patient to sit in front of us. It is loss of resources for the surgeon also, because see, they have a, like in AIMS, they have a huge waiting list.
Yeah.
Maybe in a government hospital they have a huge waiting list. They cannot afford to do the screening. Dentists need to do, then they should refer to a surgical oncologist if there is a doubt. If there is a not doubt, if there is a proven case, the dentist should be diagnosing the case, referring the case, and again that patient should take the follow from the dentist. The circle will get completed
True.
only if the dentist again sees that patient. That is what is not happening in our country. Dentist general perception, if he sees a patient, कुछ गड़बड़ है, he will just say go to higher center, and he will never wish that patient should come back to him.
Why is that, doctor?
They're afraid, the dentists also are afraid of seeing the patients, they are afraid of seeing the side effects, because they do not know how to manage the side effects of radiation, surgery, chemotherapy.
Mm.
So It's not about prevention, early detection dentists should do. The role comes after the treatment also,
Yes, of course.
because dentist is the only person who will help patient in maintaining good oral hygiene, will help patient in giving the relief for tooth pain, if any patient, because see, they are going to have the tooth pain because so much of traumatization from surgery, from chemotherapy, from radiation, they will have a lot of problems. When you visit to the operating surgeon, he will say go to a dentist. When you go to dentist, he will just say go to a surgical oncologist. Now a patient is hanged in between.
And this is what is the issue here, because when the patient sees here, I'm not able to get the right advice, and
Yes,
many patients, they just go back, say, okay, yeah, let's leave it. I'm done with running around here and there. This is also one of the concern,
yes,
right? One of the concerns that we see. But again, we need to channelize it.
yes. So the proper referring channel and going back, the circle should get completed by the patient should take follow up from the dental clinic whomsoever he has been referred. See, as I said earlier, I visit Jodhpur every month so that I can see all our patients. Rather than these 50 patients with the relatives come to Ahmedabad to
Yeah,
get it examined by me or to consult me. It's easier that
it's very easier, very easier, and
I
I
come
think
down, see patients, and give them whatever solutions they have about whatever issues they have. I give them solutions,
true,
and
rightly said.
that gives a good follow up also.
Absolutely. So, doctor, we were talking a lot about the oral cancer. Like, at times I've seen the patients, they have this fear for the surgery, right? So, what is this fear all about? If you can just tell a little bit about that.
Yeah, I agree with the patient's fear is very important, wherein that is the reason for their late reporting.
Right.
As I said, 70% of these patients they come on stage 4.
Yeah.
They know that they have some disease, but still they had a fear ki if I go to a doctor, he will diagnose me with cancer, he will do some big surgeries, my face will get deformed, I will have problem with eating, I will have problem with swallowing. So social acceptance will be a it's problematic for them. So this surgical fear, because they have seen earlier the surgery was just to take it out the tumor and put some skin. This local flaps were done to cover up the surgical site. But now the surgical techniques have taken over,
There's an advancement.
advancement. So for all our patients, we do microvascular free flap surgeries. These are kind of transplant surgeries. So
Okay.
if we remove a piece of bone, or if we have to cut the lower jaw, I will take a bone from the leg
Okay.
and I will transplant here. It's kind of auto transplant.
That's great, doctor.
So we take the bone from the leg
Okay.
along with these kind of blood vessels.
Okay.
So I put it here, fix the bone, and then I connect these small vessels. These are called microvascular. So these vessels with the neck vessels. So one vessel, the blood will go into the that plastic surgery. One vessel, it will come down. So it's a kind of a auto transplant.
Yeah, this is an auto transplant, and
Yes,
and this is happening now. This
this
is
is
happening
happening
now.
for 95% of patients. We do this procedure because that is what the advancement, that is what is combating the surgical fear. If somebody has a surgical fear, if they sit with my patient for 10-15 minutes, patient will come and say, Sab, I'm ready for the surgery, because that is the kind of outcome we need to give.
Right.
We need to be careful about the quality of life.
Absolutely. That's what is
See,
important.
everyone now needs a quality of life.
True.
If somebody have to recover from cancer and they have to spend the whole life, they should be socially acceptable. No patient can just put their tie a rumal or handkerchief and get into the public.
There's no need to hide it,
There's no
basically.
need to hide it. Now, if you give good results, people accept it, and
It's
they
kind of a plastic surgery,
it's a
but it's
plastic
not
surgery,
plastic. It's an original surgery, because you are actually just,
recreating the jaw,
recreating the jaw.
we recreate the tongue, we recreate the buccal mucosa.
Right.
So everything we do reconstruct with these kind of plastic surgery, wherein the patient have good aesthetics, the quality of speech is good, the swallowing is good. So patient's surgical fear goes down if they see
Right.
these kind of patients. As I said, now the radiation also the machines have evolved. Earlier they used to get lot of side effects
True.
from the radiation, but now the new machines have come now. The tomotherapy, the IGRT, IMRT. So new techniques have come wherein the side effects are very
Less.
less compared to the
Maybe less than before.
less than before. Earlier, definitely they used to have a lot of side effects, but now they have less side effects. So I think a patient's what they carry a image of cancer treatment in their mind that need to be broken. That can be broken only when a patient comes to platform like this, sit in front of you and talk.
Absolutely.
Because see, it is difficult for me to convince all patients, but when a patient talks, that is more convincing to everyone.
Very true, sir. Very
So I
true.
think that is going to make a lot of difference. And the quality of life, every surgeon also should strive for good quality of life for their patients. I think that is what the surgical fear that's how we can combat it.
You have really explained it so very well, and I really wish that whoever is watching this podcast will get the benefit out of it.
Yeah.
So a few more questions that I have is like, what are the myths, as per your opinion, which we normally see in this particular, about oral cancer?
Yeah. So the very common myth, first as I said, दांत निकाला cancer हो गया. So that is because patient already had a problem which is underlooked or overlooked by the my dental colleague or the dental professionals, and the tooth has been extracted. Because of that, they have been developed, diagnosed with cancer, and patient thinks कि दांत निकाला उससे cancer हो गया.
True.
It's a first myth. Second, after biopsy, the disease spread fast.
Hmm.
There are many patients, if I look at the disease and, if I suggest them to undergo biopsy, so patient will have reservations. He will say, "Sab, आज तो नहीं कराना है, आप एक बार दवाई दे दो."
Hmm.
I could understand. We now with our experience, I could understand that this patient,
Habit of postponement, which is quite common
which is quite
in our
common,
society, कि ठीक है बाद में कराएंगे.
बाद में कराएंगे, आज तो दवाई दे दो, because he has a fear कि कहीं मैं कैंसर करा. There are two fears I
Hmm.
talk about. एक, he has a fear कि कहीं मुझे कैंसर तो नहीं हो जाएगा, कैंसर तो नहीं है. He doesn't acceptance नहीं है. So
Acceptance is
that we
not
call
there.
it as they lack acceptance. कि मुझे कैसे कैंसर हो सकता है, मुझे कैंसर नहीं होगा.
True.
सेकंड, दिस फियर कि मैं बायोप्सी कराऊंगा और उससे मेरा कैंसर जल्दी फैल जाता है. सो दैट myth of spreading the faster cancer is no more.
Is no more.
Biopsy is a gold standard. Without biopsy, no treatment can be done.
That has to happen.
Technique of biopsy have changed. Earlier we used to do different kind of biopsy wherein we used to take sutures or टाँके लेते थे. But now we have a simple punch biopsy technique
Okay.
wherein we take a small tissue and from the center of lesion and send it to the lab. So the fear of spreading the disease has gone down.
Mm.
There's no chance. I usually tell them, I'll guarantee for you that this disease is not going to spread by me taking a biopsy.
True.
But at the same time, I tell them, you get a biopsy done if you want a treatment.
Right.
It's not for my testing ki
Absolutely.
whether I have a cancer or not. आप बताओ, and then you wait for 3 months or 4 months कि कितनी बीमारी बढ़ती है, and then I'll go for some treatment. मैंने कहा, don't do that.
Hmm.
You should be ready. I explain everything. If biopsy comes positive, this is what the treatment should be done. If biopsy comes negative, a positive, negative, this is the treatment should be done.
True.
If you are ready for either of these two, you can do a biopsy. So they have, and more than I say the patients, it is a family decision which matters.
Hmm.
The patient will be always under fear. We understand that.
Yeah.
A good, cooperative, supportive family will help patients in taking the right decision.
Very true. Very
So the
true.
counseling of the family is also very important. Many times family comes and they say कि आप उनको मत बताना कि उनको कैंसर है.
They want to hide it.
They want to hide it. But it doesn't go. I tell my patients,
That
see,
doesn't go well. That
he
doesn't
he
go
need to accept it. he need to accept it. I got this disease, then only he can fight back. And you and me, howsoever smart we become, not telling the patient understand that he had got a disease and he is going to get operated for this.
True, very true.
And added to this, patient have, as I said, social fear.
They don't want to tell.
मेरे बाजू वालों को ना पता चल जाए, and that is the reason that patient doesn't come to these kind of platforms.
True.
If we invite them, patient will never come.
They don't want to openly talk about it. Basically.
Yes, because they don't want that their family members, their nearby dear ones, they should know that he has been treated for cancer. There are few handful of people who accept and come to the public platform and say, I had a cancer and I am recovered from that cancer. Because there are a lot of social stigmas available. सबको ऐसा लगता है कि इनके फैमिली में तो कैंसर चल रहा है, हमको इनकी फैमिली में शादी नहीं करनी चाहिए. यू नो, पीपल हैव कि दे बिकम वेरी, आपके लिए थोड़ा ऐसा हो जाता है कि ओहो बेचारे को कैंसर हो गया. दे बिकम, यू नो, दे
sympathize with you.
हाँ, that sympathize with you. So that is the word. So they बेचारा के जैसे ट्रीट करते हैं, ओहो बेचारे को कैंसर.
And nobody wants that treatment basically.
किसी को नहीं चाहिए. So that is, these are two social stigmas associated with this cancer. So I always tell, see, cancer is, it's not just a disease. It is an emotion.
It is an emotion.
It is not about a single person. It is about the family.
True. It's about the family.
It is about the family.
Doctor, I would like to ask, like, oral cancer is a very broad term.
Yeah.
What all categories and types does this oral cancer has?
See, in oral cancer, we have different subsides. So patient will have lip cancers, patient will have upper jaw cancers, lower jaw cancers, cheek cancers, the cancers of tongue, floor of mouth. So different oral cancers can be there. Then we have thyroid cancers, which is, you know, again, it's a kind of treatable cancer, 100% curable cancer.
Okay.
Thyroid cancers. Then we have voice box cancer. Again, that has got a very good prognosis. The voice box cancers, those who usually habit of the BD, those who have a habit of BD cigarette, they commonly develop this voice box cancers.
Okay.
Like Rakesh Roshan he had a throat cancer, but early stage he has been treated.
It got detected and he got treated.
Yes. So how, that's what many people say, ki how celebrities get the right treatment and they get recover. You know? So we always say, because it's their early detection.
Yes.
If they also detect it late stage, it's not the money which make them survive.
True.
See, Irfan, if you remember, you know, Irfan Khan. So he had a bad cancer. The moment he detected, within 3 months, 6 months, he was no more.
Because it was the last stage.
It was the last stage. So again, it hardly depends on how much money you have, but it depends on what stage you detect.
True, very true.
So again, I emphasize on early detection.
Early detection. And definitely
every cancer gives you symptom. Every cancer gives you symptom. No cancer will happen silently. कहीं ना कहीं symptom होता है. For an example, Yuvraj Singh had a cancer, right?
Yeah.
He was playing and he was coughing blood, but he ignored it.
He ignored it.
Because he wanted to see, he is very well-known celebrity.
True.
He wanted to play the match. He said कि इस match के बाद मैं देखूंगा. He played the next match, then went for the testing. Then he's been diagnosed. He underwent chemotherapy, he underwent treatment. He's recovered. So how these people recover from the treatment is, see, their will, family support, and the right time diagnosis. True. Which is what is lacking in our part of Rajasthan or in our population.
True. Very true.
Yeah.
Doctor, we were talking about the oral cancer. Yeah. Right. Let's talk about what is the complementary, the cancer care that you were talking to me a while back. Yeah.
So when we talk about the cancer treatment, we, as I said, primary cancer, that's surgery, chemotherapy, and radiation. And every patient needs complementary cancer care, which is lacking, unfortunately, which is lacking in our country, and especially this part of Rajasthan. They hardly, doctors are not much talking about it, and neither patient, as we said, they are not aware about it. So let's talk about complementary cancer care. So complementary cancer care means if patient need to be rehabilitated. So what is that rehabilitation? First, it starts with the dental or oral rehabilitation. Now every patient need to visit a dental professional for a scaling, for cleaning mouth, for as we spoke earlier about maintaining good oral hygiene, and patient also wants to eat, right? Because in our cancer treatment, a lot of teeth are being extracted, a lot of disturbance in the chewing. So a dentist should give the teeth, because teeth only can help him in chewing the food. Otherwise, they'll be liquid diet for whole life.
True.
You imagine a patient, your relative, you are having some good stuff on a dinner
Hmm.
table, and your relative is just drinking something. You will
And
you
and
will
and
feel that
that
pain.
that person can't eat. Imagine the kind of pain that person is going
Yes.
through.
So that, as I said, that pain is felt by everyone in the family.
Hmm.
He can just only drink. So the dental have very important role. They can do the rehabilitation. So the dental rehabilitation should be complemented with the treatment.
True.
Then comes the physiotherapy. Now physiotherapy is an integral part of any surgery.
Very
See,
true.
our body is meant, if you manipulate any system, that
Hmm.
need to come to again the normal situation. That
True.
only can come with the physiotherapy.
Physiotherapy. So that is very, very
So
important.
physiotherapy of, especially in oral cancer, physiotherapy of neck, mouth opening exercises, and shoulder. What is happening in our country? These patients who undergo radiation, these are the muscles which helps in opening the mouth. So when the radiation is given, these muscle contracts. So
Hmm.
mouth opening is reduced.
Okay.
If they do not do continuous physiotherapy for mouth opening, they will have this much of mouth opening. They
And they
cannot.
won't be able to open their mouth.
No. And unfortunately there is no way out.
There's no way out.
They have to be on this decreased mouth opening for a lifetime. So oral physiotherapy,
It's very,
neck
very important.
physiotherapy
Very,
again
very
is a
important.
very important I see. Third things comes for speech therapy. Now, as I said, if we do not remove voice box also, the patient wants to have a very normal speech. Suppose a patient is being operated for tongue cancer. So tongue has a function of speaking and swallowing, isn't it? And
Right.
chewing. Three functions.
Right.
So all three functions will get compromised. So that speech and swallowing need to be improved by, there's a special doctors or there's a special team of members who help them in speech and swallowing therapy.
So you have in-house
We have in-house.
specialty for
We have
this.
in-house because we give patients all complementary cancer care. Then fourth comes the dietitian. Now you must be very familiar that every individual now needs to be, they need to have a good nutrition. Because why? Only 40%, 60% development, not 40%. The genetic and nutrition also play important role.
Very, very vital role.
Because when we were talking about the causes of oral cancer, it is nutritional deficiencies, again documented cause.
Okay.
So the nutrition should be supplemented enough. The diet should be, diet play a very important role in the body's immune system.
Mm.
We also, we need to understand, even, as a doctor, we need to have a very specific diet which help me in keeping the cancer away.
True.
So that is for everyone.
Yeah.
So especially after cancer treatment, now at least we give them the right food, diet. For an example, the sugar intake should go down. There are a
Mm.
lot of things should be added, a lot of things should be
It
subtracted.
removed. Yeah. Very
So I
important.
think diet and nutrition play a very vital role. Again, we have a dedicated unit
Yeah.
who do the dietitian, are they play important role, and cancer nutritionists are now in our team who guide the patient for the right treatment. Then comes the role of Ayurveda or homeopathy. See, Ayurveda is definitely a branch which deals with, treatment of all these diseases. But I'm of an opinion that Ayurvedic should come in role of complementary, not in the primary. Because we have not seen any patient got cured of the cancer with the Ayurveda. And I usually tell my patients also that, see, we as a doctor, we talk on evidence-based things.
True.
If you show me an evidence, I'll accept that. कि सर don't tell me कि उनको कैंसर हुआ था और वो आयुर्वेदा कुछ लिए ठीक हो गया. I'll see, for me it is not one example. For me it's a research paper. So what we say is, I do not have any against thought about
Basically,
Ayurveda.
we need evidence.
We need evidence, but yes, I'm of a opinion that Ayurveda will help you 100%
For
in
recovery.
recovery and upgrading your immunity. Take Ayurveda, take whatever they say. There are a lot of patients, I have seen they are into Ayurvedic treatment, and I push them into Ayurvedic treatment. You take treatment, I have no objections. There are people who are into homeopathic. Homeopathy also, they prevent the disease, or rather I can say they can prevent second cancers.
Okay.
So they can take treatment. Ayurveda, homeopathic also, they can take treatment on that. So these are, and the last thing is the
But not as primary. That's
not
what
as
you're saying.
primary,
That's
not
what
as
you're saying.
primary. And the last thing is psychological counseling. It is, I tell you, it is my
I was about to ask you
experience
that
of 16,
question.
17 years that positive mindset
Is very important.
is very important for disease recovery and the decreasing the recurrence of the disease. And it is not only about patient, it is about the family.
True.
See, family need to accept that patient or that person as a, that he has recovered from cancer, and they should be keep motivating him, supporting him in all the ways possible.
True.
Then only he can recover from that.
Absolutely.
So psychological counseling not only for patient, but it is for family also.
For family also.
And this is what is happening across the globe. I was in a US in one of the Sloan Kettering Cancer Center is the world best cancer center. And there I have seen that 70 to 80% of these patients who underwent treatment, they undergo complementary cancer care, which is not even 5% in our country. And it is all about, we are not integrated.
True.
The concept is the integration. So we are coming up with integrated medical sciences,
which is very, very essential.
Which is the
in today's era. Basically,
era,
because
integrated medicine.
Absolutely, because as you very well said that a complementary care helps you for the complete recovery. I would say holistic
recovery of patient from these kind of diseases. So that is what is required, and we need to integrate all these people. So when we talk about treatment of cancer, it's a multimodality. अभी क्या होता है, लोगों को लगता है हम सर्जन के पास गए, उसने ट्रीटमेंट किया, that is end of it. But surgery is just a part of it. It's not the whole treatment. So a surgeon also need to understand that I have a small limited role,
right?
And patient also need to understand that he has a small role, but I have a lot of people around which can help the patient and the family in recovering from it. So that is the role of a complementary cancer care. And I'm happy to announce on your podcast that we are coming up with a conference on complementary cancer care, not only for doctors but for the patients and relatives. Usually the doctors conference, they just call doctors, we just disseminate the knowledge what the experienced faculty have, and they go home.
True.
But we want a conference wherein we want the patients and relatives to come interact with the faculty on stage directly,
which is so good.
See, when a patient talks about his problems.
So basically, you guys are doing it regularly.
Yes, this is the first conference we are going to conduct in September 2026.
Wow, next year.
Next year at Ahmedabad we are conducting.
That's so good to hear, doctor. So we will definitely bring a podcast also related to that.
Sure, ma'am. Sure.
That's very, very important.
Yeah.
And I think for this podcast, you have really given so much of information, and we have created so much of awareness together. And I know there are a lot more left. There's a lot to come from you. But yes, we will cover everything in our next podcast because we have a lot to talk.
Yeah.
So thank you so much for your
Thank you,
time,
ma'am.
Dr.
Thank
Shakti
you.
Singh. It was such an honor to talk to you, and I really feel that we have really created a very good awareness, and all the users and the viewers who are there, they can subscribe my channel and they can put their views and messages as a comment, and we can definitely get back to you if you have any further questions for the doctor or for anything related to oral cancer. And yes, we are coming back with another podcast soon with Dr. Shakti Singh.